I'd like to invite Professor Vivienne Wilson from the dentistry faculty. And she's a champion in that area. And Prof has now implemented the use of video recordings also for reinforcement. So thank you, Prof. And welcome.
Thanks, Juliet. Thank you, and thank you to Juliet for inviting me to present what we're doing. I thought I'll show some pictures. Pictures also always speak to me, and I like pictures. So I'm in the restorative dentistry cluster, and we are two departments. So we are basically involved with restoring what is missing in people's teeth. Caries, enamel, people that have lost teeth and fixed prosthesis, as well as partial prosthesis, and this is what I'm going to talk about. People who have lost tooth structure due to wear, etc. Implants, which is quite popular nowadays and very expensive, and then our normal dentures. I'm sure you're aware of that. We in the Western Cape have a very large population of people without teeth, and politics, we can talk about that another time. So I'm going to talk about, in my module that I'm going to talk about is about replacing missing teeth with removable partial prosthesis. Thank you. Students are doing this course or this module in their 4th year. And, you know, or you might have heard that size is not an issue, but size is an issue, especially in dentistry, because we like it long and big. And I'm talking about canines and molars, and I'll talk about that. So when students are coming in, they need to be taught about what teeth we use. So ideally, we want to have people, or we would like to have patients with all their teeth, because that is ideal. And studies have shown that you've got quite a big surface area. So if you've lost teeth, this is probably the worst that patients can present with. 45 centimeters squared is saying that what we have in the upper and the lower, and it reduces to 20 and 12, and that's one of the reasons why people have difficulty getting used to lower dentures. And if you're medically compromised and you have other problems, then you actually lose bone much more easily. This is a very common picture here in the Western Cape, where people have lost their front anterior teeth, and there's various reasons for that, which is another discussion. And we don't want to have people losing their other teeth. So our job is to maintain what is there, to restore function, because if you have lost teeth, your speech is involved, is compromised, function, eating, etc. So when we replace, or when patients present to us, we have an option of fixed prostheses or partial removable prosthesis, which I'm going to talk about. And this is basically what we can do in our partial patients, students in 4th year, and you know, we start in 2nd year, 3rd and 4th year, and all is building blocks where we actually have to apply that. And when students come into the block, they need to know which teeth to use. Like I said, we like the long teeth because we find that actually gives much more retention and support. And students need to know what are the options that we can do for patients. So the block is usually a week-long preclinical that students are taught mostly the theory, they're getting demonstrations, etc. And then they have to go apply all these principles in the clinic when they go see patients. Like I said, it's a week block for 4th year students. Now we have involved our training or our teaching, and I'm sure you know that we're all dentists by training, so we're not teachers and educationists, but with all the teaching and learning developments, and Professor Parker is here to make sure that I mention it. We had lots of workshops where we actually have been discussing and taught many other techniques. So we've done small group and we've done all of these, but we still find that when students come to the clinic, it's very difficult for them to put the theory into practice. Most of our teaching happens around the chair side when we have the patient, which is quite stressful. And so when they're doing, and all our teaching usually before the clinics is in the preclinical blocks, and then they proceed to the clinics. And for students to make the link, and maybe we don't always make it or enable students to make the link between the theory and the practice. So they couldn't apply it, and all these basic principles about which teeth to use, whether it's a canine or a molar, they will apply it when they do the fixed prosthesis, which is in the 5th year. When they do implant supported dentures, because you need long implants, etc. Support, we talk about, support has to do with whether you have healthy teeth, because if you have a healthy tooth and a nice long tooth, the success of your partial denture or your fixed prosthesis will be much better. Retention is about, if I can go back one slide. So support is about the teeth that we use, where we will sit the denture on, sort of. Retention is about the clasp that we use. So if you look at this is a clasp or that metal container, metal attachment. And these are to keep the denture in place. And students need to know that so that they can apply it when they go to the clinic. So we know also that our students are very technologically advanced, much more than what I am. And thinking of new things and ways to actually make it better for them to apply the theory. So I've consulted with Carolyn and Andre and Bradley, and we decided to do the video recording of the designs or the drawing of the partial dentures. I mean, before that, obviously, there's lots of other things that went into this. So the preparation and everything, and eventually everything was put on a CD, a DVD, with the help of Clint, and each student, undergraduate and postgraduate, were given, and as well as the staff. So this year in the block, we gave the student the CD with all the module lectures, etc., because students also complained, if you give them notes, it's not in color, they want it color. And they have the CD where they could see the drawings, how it's drawn, etc. And they could actually go back and look at it again because it's exactly the way the lecture is. So once we've done the lectures and when they go to the clinics, if they have to prepare the patients for this, they could go back and look at the CD and see what has been done. So each student was given the CD. And with the preclinical blocks, the students actually like that much more than the clinic because teaching usually happens in a much more relaxed atmosphere. And the feedback, because we have to do evaluations, the feedback, so this was the first time we've given this, feedback was quite positive from the students. And there's a lot of other things that can still be improved about it. So during the block, the CDs were there, we've used the resource center, and I think the students in this module was the first to use the resource center. And we had a very hands-on approach, and hopefully, and it's a bit maybe too early to say that maybe when they go to the clinic, there will be much more sense-making of what they have learned in the preclinical block. The challenges remain is that we must use more, and being off campus is sometimes a challenge because we're not right here, but we also have the team coming to Mitchell's Plain and to Tygerberg to do the training of staff. Student access to resources. Now our dentistry students are their student life is actually very hectic. They in the faculty from 8 to 4:30. It's very intense. And during the day there's very little time to make use of the resource center, and I think access maybe after hours is something that we have to work at. When we looked at the series for the first time, so there was some detail loss with my hand obscuring it, etc. And listening to it the first time was actually not so nice because you listen to your voices like when somebody video records you, you never know how you look and how you sound. But anyway. So the way forward is that I think we need to make use of more of, we listen, and the whole day, this morning we're going to listen to all the things that can be done with e-teaching. And at the moment we're busy with, and we've got Carmen and Sia here, our dental technicians, who is also busy with video recording, the practical, and we have to do more of the clinical procedures also. And it will also give us a good forum to evaluate our teaching practices and obviously to write on it. And I've talked about the access. So I've got a small, just to show you what we have done, and I'm a short snippet of one of the videos that were recorded. So it's basically incorporating the drawing techniques.
It's also a class 3 modification 1, 2. Remember, we always classify according to the posterior saddle and if we are going to replace teeth. Now this patient had 2 centrals removed And we've got a lateral, and the lateral has abutments anteriorly. Posteriorly, we've got premolars and molars. The challenge with lateral incisors that they do not, in most cases, provide adequate
So that is where
support.
size come in, you
And
know, with
in this
lateral
patient, I
incisors.
will then, because I have canines and the canine is a nice, firm, sturdy root, I will use the canines to give most cases test again, because edging undercut is drawn up. Test again.
So it's basically drawing and showing the students how to draw the designs, you know. And before that, obviously, they need to know the theory about which teeth and why, and the preparation of the patient that we do in the clinic and in the laboratory. Yeah, so that was just the short snippet and then showing them options of different materials. So we have the metal designs and then we have acrylic. So we recorded about 15 of these videos, which will give the students 30, and that's about trying to show them a variety of removable partial dentures that we can show the patients. And that's about it, and just want to acknowledge these important people that made it happen. Thank you.
Any questions, comments?
Thank you.
Thank you, Vivienne. As you can see, if we don't have enough space online, we also help you to create offline material. It's very important. You need to think about a blended approach. It's still important for our learners. And Prof. Parker, we admire Vivienne because she doesn't wait for everything to be perfect. She's not one of those that say, I only do it if the bandwidth is right. I'll only do it if my voice is perfect. And she's a lifelong learner. So she makes mistakes and she carries on. And this is what it's about. Did you see that Khan, Hassan, the Khan Academy with the maths? He didn't wait until he was a perfect, in his natural tone. I mean, look who he's reaching. And this is about the online environment. We are knowledge creators, but maybe we're so afraid of being out there, you know. So Vivienne, we admire you for being a lifelong learner. Thank you very much.